that's really challenging for us to.
Cassandra Mason's youngest two children both have Down syndrome. She says her youngest, Willa, had open heart surgery 5 months after birth and now has severe low muscle tone.
She struggles to do everyday things that are really easy for you and I, like eating, swallowing, walking, sitting up.
She says Willa regularly sees 12 doctors and specialists. Additionally, Andwell Health Partners provided a physical, occupational, and speech therapist for weekly in-home visits, as well as an in-home nurse.
It's essential. It's essential for her growth and development.
She and 96 other parents got a letter from Andwell saying in-home services would end on January 7th because they don't live in Lewiston, Auburn, or along Route 202. In a letter to those families, CEO Ken Albert says Andwell can no longer absorb the profound multi-million-dollar financial losses associated with providing pediatric skilled home-based services to certain Maine communities.
We're seeing an erosion of providers who are willing to take Medicaid as a payment source for providing services. There's just no way under Medicaid reimbursement to make the ends meet.
Cassandra Manson, who lives 13 miles from Lewiston in Bowdoin, sent a response. She says Willa was redlined and discharged because of the town we live in. Please explain to me why my daughter's care is more expensive than a child living several miles away from me.
All of these kids should have equal access to the services and the health care that they deserve.
Albert met with the Health and Human Services Commissioner, MaineCare Director, and lawmakers trying to get an increase in reimbursement rates. He also now says they will not abandon these families.
If we have not been able to effectuate a safe transfer of care, I'm not walking away from these families. Our clinicians are not going to do that, right? We will continue to provide services until we can really manage a safe discharge of these kids.
So we agree that the root of the problem is MaineCare. However, this was not a good option. This was not the right move.